In today's lecture, we're going to discuss the anatomy and nomenclature of the right atrium. You'll see in the following diagram that the right atrium has been isolated from the rest of the heart so that we can focus solely on these specific tissues. You'll also see that there's been a dissection made at a structure which we'll learn is called the sulcus terminalis. And what we've done is made this dissection and opened up this flap of tissue on the anterior wall so that we can visualize the internal structures of the right atrium. When describing congenital malformations, there are two common systems of nomenclature used to describe both the anatomy and these malformations, and they are the Van Praagh system of nomenclature, which we've abbreviated VP, and the Anderson system of nomenclature, which is abbreviated AN. And for each structure for which the two are named differently, we've identified them in parentheses so that you'll know that they're the same structure with just a different terminology. Now, as we look at the right atrium, we want to notice that the right atrium receives blood from three sources, and those are the superior vena cava, the inferior vena cava, and the coronary sinus. And these three structures all drain blood into the right atrium. And when blood flows into the right atrium at this stage, it has not yet gone to the lungs to receive oxygen. So this is blue or deoxygenated blood. However, we want to note that in utero, the right atrium is formed from the merging of two structures, and that is the primitive atrium and the sinus venosus. When these two structures merge together, they are given a new name, which is simply the right atrium. Now, the groove at which these structures join is called the sulcus terminalis, according to Van Praagh, or the terminal groove, according to Anderson. And all that simply is along the external aspect of the heart, it's just a little groove that runs along the side of the heart. And on the exterior side, we would call it the terminal groove. But if we were to open the flap as we've done here and look at the inside, that same groove would be delineated by a ridge of smooth-looking muscle tissue known as the crista terminalis, or the terminal crest. And it's simply the small band of tissue that runs along the side of the right atrium and forms this muscle. And in fact, the terminal crest separates out into the pectinate muscles. Now, pectinate is a word that derives from the word pectin. And the word pectin refers to structures in nature that form parallel lines, such as you might see in a seashell or a clamshell. And these parallel lines are given the name pectin, and so we have the pectinate muscles because they have a parallel ridge structure inside of the right atrium. Now, the crista terminalis helps to separate this pectinated muscle from the smooth, and this is on the anterior side, from the smooth posterior side, which is called the sinus venosus, or the venous sinus according to Anderson. The sinus venosus refers to the embryonic tissue though. In a mature heart, it should properly be called the sinus venerum, the sinus venerum. But you may hear these two terms used interchangeably. However, properly, we want to note that this is the anterior pectinated side, and this is the posterior smooth muscle. It's not smooth muscle, it's cardiac muscle, but it's smooth in appearance, known as the sinus venerum. And that is structure number 3. Now, in utero, there is a hole between the right and the left atrium that shunts blood away from the lungs and towards systemic circulation. And that hole is called the foramen ovale, the fourth structure we'll discuss today. The thing to note about the foramen ovale is that this hole is formed from the two-layered septum. So the septal wall here actually has 2 layers to it. And the way that it works is the septum primum, which is on the left atrial side, and the septum secundum, which is on the right atrial side, are sitting right next to each other, but they have a little bit of a gap so that blood is able to flow in between them from the right to the left atrium. However, once the baby is born, this hole begins to close, and when it does, we see that the top of the septum primum merges and fuses together with the bottom of the septum secundum, so that blood flow can no longer pass from the right side to the left. Now, when the septum secundum and the septum primum fuse together, they close the hole, leaving an oval depression called the fossa ovalis, which is made of septum primum tissue, and the limbus, which is the septum secundum. Looking at our diagram, we would say that this tissue at structure number 4 is made of septum primum tissue, while the margin, the superior margin of this tissue, is the septum secundum tissue at structure number 5. And so we need to make sure that we understand the difference between these two. And in a heart, you would just see a little ridge of tissue around the top margin of the depression where the foramen ovale used to be. Now, we talked about the coronary sinus draining into the right atrium at structure number 6. But there's a flap of tissue called the Thebesian valve that helps to direct the flow of blood from the coronary sinus, and that's at structure number 7. Right next to it, at structure number 8, is the eustachian valve. And this valve is particularly interesting because it's associated with the inferior vena cava. In utero, this valve is larger, and it helps to direct blood flow away from the tricuspid valve and towards the foramen ovale. The purpose of this is to assist with that right to left shunting of blood. And so we want to direct blood flow away from the tricuspid valve, which would send it to the right ventricle, and then to the pulmonary artery, and then to the lungs. We want to shunt it away from there and directly to the foramen ovale, where it can go directly to the left atrium and then out systemically. And so we see that once the baby is born, the size of this valve greatly diminishes and it becomes much smaller. And so this would be the eustachian valve. Now, we've said that the tricuspid valve is found in the right atrium, and it's made of 3 tissues. In fact, this actually is the transition point between the right atrium and the right ventricle. It has 3 leaflets to it, which we'll discuss in more detail later. But for now, just note that the septal leaflet is on this side, and it's going to be useful in just a moment. The tricuspid valve is surrounded by the vestibule, which is labeled as structure number 10. The vestibule simply helps to direct the flow of blood towards the tricuspid valve. And it's simply a smooth bit of tissue that sort of depresses in towards the tricuspid valve. One other structure I want to mention is the tendon of Tordero, which runs alongside, in a margin, alongside basically in the middle of the posterior wall. And this tendon is useful in helping us to locate Cox's triangle. Cox's triangle is a triangle that is made of 3 sides. The tendon of Tordero, which we've identified as being right here. The coronary sinus forms the base, so we could say the base of the triangle would be here. And the septal leaflet of the tricuspid valve makes up the side of the triangle. And the point at which these 3 structures merge together would help us to identify the AV node. Now, the AV node and the SA node are bundles of conductive tissue, but they don't actually look any different in a heart than any of the tissue surrounding them. And so one just has to know where to look for them. The SA node is usually easier to identify or to predict where it is because it's where the superior vena cava, it's at the base of the superior vena cava where it meets and joins with the right atrium. However, the AV node can be a little trickier to find, and thus Cox's triangle helps us to figure out where it's located. Now, the last thing I want to discuss is the right atrial appendage, which includes all of the pectinated muscles in the right atrium, including the anterior wall, that is used interchangeably with the right auricle, which is only the broad triangular appendage that is covering the root of the aorta. So, by definition, the appendage is made of pectinated muscle, and so it includes both the right auricle and all of the anterior wall, which is also pectinated. However, only the right auricle is that broad, flat, triangular appendage, and it actually covers the root of the aorta, which is then which cannot be visualized externally because of this flap of tissue. The usefulness of the right atrial appendage is that when looking at a heart, one can usually easily distinguish the right atrium from the left atrium by locating this appendage. The left atrial appendage is usually longer and more tubular shaped, whereas the right atrial appendage will have a more triangular flap to it. And so these structures make up all of the anatomy that you are likely to encounter beginning out in the right atrium.